Hello everyone, I am Dr. Vibhor Borkar. I am a pediatric gastroenterologist, hepatologist and liver transplant physician practicing in Mumbai and Western India. In the previous videos, we have seen what is irritable bowel syndrome and how stress and anxiety triggers it. In this video, we are going to see how food affects IBS and how to manage your child's food. So choosing a right food for your child when he's suffering from IBS can be really stressful. So let's see what to avoid and what to include in the diet. Now recently the most important concept about this food and IBS is low FODMAP diet. So what does this FODMAP means? Let's see what this FODMAP stands for. So it means fermentable oligo di monosaccharides and polyols. Don't get confused with this long word. What it means is in the diet or in the food there are certain sugars which our intestinal juices cannot digest it. So what happens with them? So these sugars undigested from small intestine, they go to the large intestine. Inside the large intestine there are bacteria which ferment these sugars, and because of that a lot of acid and the gas releases that causes pain, bloating and sometimes loose stool. Let's see the culprit food items which can trigger this food related IBS symptoms. So the most common in your kitchen list is dairy and dairy products like milk, then fried foods like samosas, potato chips. Apart from that, large amount of certain fruits like apple, watermelon, sometimes chole, rajma and even cabbage and cauliflower. These are the common food items. Does this mean that we have to stop all of this? Of course no. You have to find the pattern and be very observant to see after eating which kind of food the child has this symptom. So you have to selectively stop this item. Apart from that, you have to decrease the quantity. The kids should not be eating a large proportion of this and should eat a small aliquots of this. So to handle this, what we should do? One can go for have a probiotic course or natural probiotics like having a curd, good amount of water and small and frequent foods. Just avoid blindly stopping a long list of food. It can actually backfire rather than any benefits. Stopping all this food for a long time can actually lead to nutritional deficiencies. So it is advisable that to follow this diet after a supervision. So consult your dietitian, pediatrician or pediatric gastroenterologist. So friends, choosing the right food items can definitely help us to improve the gut health, decrease the problems related to irritable bowel syndrome. So if you find this information helpful, please like this video and subscribe to my channel and forward this video to the parents who may find this information useful. Thank you.